Now on to our Health Watch, where we discuss all the topics that are trending in the medical world. As always, we're joined by Dr. Syed Hussain from Trinity Health of New England, joining us over Zoom this morning. Doctor, good morning to you. How are you today?
Good morning, Tim. Great to be here.
Yeah, glad to have you here. And we've been talking more about those seasonal viruses ahead of the holidays, not just the flu, but of course COVID, RSV. The big push has been to vaccinate well ahead of this day to give your immune system time to sort of get up to speed. Of course, it might be never too late to get vaccinated, but you're not going to get the full effect at this point. So what else can people do just to be reasonable with their precautions to make sure they're not getting themselves and their grandparents sick over Thanksgiving?
Absolutely. Great question, Tim. So a few things I want to remind viewers. First and foremost, we are expecting, as you've said in the program, one of the busiest holiday weekends in years in terms of travel. So what folks need to remember is four important things. First and foremost, you mentioned vaccination. This is the time now to get vaccinated. Get the COVID-19 vaccine that was approved by the FDA, endorsed by the CDC in September, along with the influenza shot, the flu shot. Second, masking. So, it's not a bad idea to mask up, especially if you're in an indoor crowded situation with poor ventilation. Third is use those rapid tests. You are eligible, Connecticut residents are eligible to get free test kits from the federal government. And order those, get those if you develop symptoms or if you're attending a gathering where there might be people that are higher risk for developing severe COVID-19 to ensure that you don't have COVID-19 before the gathering. And the fourth is if you do test positive, then you may be eligible for treatment with Paxlovid. So look that up as well and discuss that with your provider, obviously, if you do get COVID-19. But first and foremost, the tools that we've used in this during the pandemic still apply in this upcoming winter season.
Yeah, and of course with vaccines, it's a little late to be fully protected by tomorrow, but there's still Christmas and Hanukkah and a lot of ones that you could be protected for later on if you vaccinate. Now, real quick, you mentioned the rapid tests. What do we look like the most common COVID symptoms are sort of with these latest strains here? It seems like over time it's moved from a deep chest problem up more to the upper respiratory tract. Where is it now?
Yeah, that's right, Tim. That's where we currently are. It's very similar to flu, so flu-like symptoms. So if you do have, sniffles, fever, cough, upper respiratory tract symptoms, then it's best to get tested. You can get 2 rapid tests 48 hours apart to increase accuracy. If there's still suspicion, a PCR is also not a bad idea. But, in order to prevent all of this is to get those shots. Right now, data from the CDC indicates 15% of U.S. adults have rolled up their sleeves and gotten the shot, which means there's plenty more that need to get it done. And, I just want to quickly tell viewers, I'm traveling currently, but I made sure that I got my shots 2 weeks prior to actual travel. So let's keep yourself and your loved ones safe this winter season.
In the short time we have left, I want to talk about some relief that could be coming for sickle cell patients. Out in the UK, health officials have approved a gene therapy treatment to help target some problematic genes in a patient's bone marrow, and maybe the FDA could be on board with this as early as December. How big of a breakthrough could this be for sickle cell patients if it pans out with the FDA?
This can be a game changer, Tim. We have about 100,000 or so patients across the U.S. that have sickle cell disease. It's a very painful condition, and this can potentially be a game changer. So we're really looking forward to that approval and to see what happens in the U.K. with those first 2,000 patients that will start getting treatment.
Okay, Dr. Hussain, thank you so much for taking the time to join us. Like you said, you are out traveling. Travel safe. Make sure you don't come back sick, and we will see you again soon.
Happy Thanksgiving, Tim.
Happy Thanksgiving to you.